Hello everyone, my name is Jackie. I am a registered nurse working out of Omaha, Nebraska. I decided to make this video blog slash video diary to document my experiences working as a registered nurse during this coronavirus epidemic. My goal is to provide a weekly update kind of on what's going on in the hospital, any changes or policy changes that have occurred because of coronavirus. I'd like to talk about what's going on in the state of Nebraska, briefly touching on kind of what's going on nationwide and globally with this coronavirus pandemic. Kind of to get started here, I want to talk about currently what our numbers are looking like for Nebraska. Today it's Sunday, April 5th, 2020. The number of confirmed cases in Nebraska as of 5 p.m. was 363 confirmed cases. Total number of tests performed as of today, 5,933 tests performed, and that's both positive and negative testing. In the Omaha area, we are taking care of 16 positive coronavirus patients. The CHI hospitals, that doesn't include Nebraska Medicine or the University of Nebraska, which is one of our other major hospital systems here in Nebraska. As far as how many confirmed cases we have here in Nebraska, I said we have 363. That number has jumped actually about 100 cases since I looked at it last. The last number that I looked at was on Friday, and that was 279 cases that we had in Nebraska. So we're definitely increasing the number of cases that we're seeing here in the state. As far as new policy, this week was the first week that we started wearing surgical masks the entire shift, so from when you clock in to when you leave the building. That is a policy I was least looking forward to. I've just seen quite a bit of posts about healthcare workers having skin breakdown on their face, on the back of their ears due to wearing masks. I've seen a lot of ideas on how to get around this. They make little headbands that if you sew on a button to it, the surgical mask can attach to the button instead of the back of your ear. If you are caring for a patient that's positive or that's being tested for COVID-19, we would wear the N95 respirator masks. Now, something really cool about this, about us reusing them, is that Nebraska Medicine was actually one of the first labs in the country to come up with a way to re-sterilize and reuse the N95 respirator masks, and this has been kind of a response to the huge PPE shortage that we're seeing in other states such as New York. The way they sterilize them, I don't know the exact process, but I know that UV light is involved, and I know that the same N95s that we turn in at the end of the day to be sterilized will actually be returned to us. We are to write our names, our employee ID numbers, on those respirator masks to be reused throughout. Now we are allowing absolutely no visitors in the hospital. There are actually some exceptions on a case-by-case basis. I haven't seen it myself yet, but I know it would probably involve end of life. So along with the no visitor policy, today they sent out an email that states that all employees will be screened before they come into the hospital. It sounds like they're going to start this tomorrow, Monday, April 6th. Starting at 6 a.m., they're going to have everyone clock in and then report to a check-in station where their temperature will be checked, and they will also have answer some sort of a questionnaire or do a self-screening for symptoms. To wrap this up, I just kind of wanted to talk a little bit about what's going on worldwide with the coronavirus pandemic. It looks like worldwide there are more than 1 million confirmed cases. There are 62,955 deaths. This is courtesy of the World Health Organization. I know in the news right now they're calling the United States the epicenter of the coronavirus outbreak. So that's kind of a scary place to be, especially as a frontline worker, as a nurse that's going to be taking care of these patients. Some of the images that I've seen out of Italy, out of Spain, they're very scary. Very anxiety-inducing. It's hard to believe. Definitely worrisome to be the epicenter of the pandemic, but we will see what the following weeks bring. I know the infectious disease specialist, Dr. Fauci, I don't know how to say his name, F-A-U-C-I, Dr. Fauci was saying that this week is going to be, one of the more grim weeks in our history. It's worse. I am scheduled to work tomorrow. I actually haven't been to work since last Wednesday, and today is Sunday, April 5th. The reason I haven't been at work very much is because there's just not that many patients in the hospital right now. With Nebraska being, most of the state of Nebraska being shut down, anything that's deemed non-essential, so basically everything but grocery stores and restaurants is closed here. There's not a mandated stay-at-home order, so people definitely are still coming and going as they please. However, I think all of this has affected the amount of patients that we have in the hospital overall. So overall, they've been sending home a lot of nurses. Well, thanks for tuning in to this nurse's coronavirus diaries. I look forward to uploading a video next week. I welcome your questions, your concerns, your suggestions. Let me know below how I can improve. Let me know what you'd like to see, what questions you have for me. I will try to be as honest and open as I can.